Welcome to our webcast. I'm Dr. David Marks. Many alcoholics don't even know they have a problem. So what are the symptoms of alcoholism? And when should you start worrying that you might have a problem? Joining us to answer these questions is Dr. Carol Weiss. She's an addiction psychiatrist and clinical assistant professor of psychiatry and public health at Cornell University Medical College, New York Presbyterian Hospital. Welcome.
Thank you.
And Dr. Richard Rosenthal, he's chief of the Division of Substance Abuse at Beth Israel Hospital in New York. Welcome.
Welcome.
So, Carol, what's the difference between somebody who's an alcoholic and someone who just likes a drink or two?
Well, let's use the word problem drinker instead of alcoholic. An alcoholic is someone who has a problem with their drinking. Either they worry that they may have a problem or someone else has worried that they have a problem. Just that is the beginnings of wondering whether or not you have a problem with drinking. There are some specific criterion that we use to determine whether or not somebody's a problem drinker. Have they tried to cut down and have been unable to cut down? Do they get annoyed and irritable when they drink? Do they feel guilty about their drinking? And the most severe symptom is, do they have to have a drink when they wake up in the morning? That's sometimes called the cage questions: cutting down, annoyed, guilty, eye-opener. That's a sort of very easy definition of alcoholism.
But someone who likes to take a drink at dinner, a glass of wine, that's not a problem, is it?
It's not a problem if it's not a problem. If it doesn't disturb their social functioning, if it doesn't disturb their occupational functioning, if it doesn't disturb their health, it's not a problem.
Okay. Rick, Carol mentioned cage questions very briefly. Tell me about them.
What they are is a sort of set of pocket tools that most clinicians should know if they don't know it. But what you can use them for is a sort of a rapid screening of a person to see if there's really a problem around drinking. So if the idea is cutting down, that's the first cage question. What that really goes to is something that we addiction psychiatrists and other people in the addictions field have recognized is probably the most important factor around addiction. We used to think it was sort of the heroin model, okay, where you used to have to become physiologically dependent on the drug and then show a withdrawal syndrome when you stopped it. We've evolved from that. And so if you have tried to cut down, made unsuccessful attempts to cut down, that means that there's an issue about you drinking more than you had intended, okay? And so that becomes a very powerful and important symptom.
So that's the C.
That's the C, okay? The second one is annoyance. And let me go a little bit further than what Carol said. It's really more, and not only annoyance when you drink, but annoyance that other people may have pointed out to you, that they think that you drink too much. Okay, so it's annoyance at having that being brought up to you in any kind of a way. Okay, the third one is guilt, which is saying, I think maybe I shouldn't be doing this. If you're beginning to have thoughts or feelings that there's some wrongness about your alcohol drinking behavior, whatever that might be, that's a positive sign. And lastly, as Carol said, eye-opener use of alcohol. If you have to get up and have hair of the dog in order to, get yourself ready for work, you have a problem. Because that's a fairly strong sign that someone's got a fairly strong dependence problem that they need to immediately upon arising use alcohol to get up to sort of a normal state without going into withdrawal.
Well, Carol, if people answer positively with some of these cage questions, why don't they seek help?
Well, another hallmark of alcoholism is denial. It's very hard to admit that you have the problem or to even realize that you have the problem. Your life sort of starts to develop itself around your drinking problem. So if you start getting to work late on Mondays or leaving early on Fridays, you just start telling yourself that you need a little bit more rest and relaxation, for example, instead of saying, I was hungover on Monday morning from the drinking. Also, it's very frightening to give up alcohol. It becomes a friend to people, it becomes a way to cope for people, it becomes a way to have fun, and people aren't so keen on giving that up so quickly.
You touched on physical withdrawal. I think in people's minds, a lot of people think of DTs,
right.
delirium tremens, with the shakes.
It happens to people who have been drinking a lot and become physiologically dependent and then usually stop cold, essentially, and develop within several days, usually, a profound withdrawal syndrome where people become delirious and lose their orientation in terms of place, person, and time, and can have seizures. And there's a mortality rate people can die from untreated DTs. But people who have been doing heavy drinking for weeks to months, very often, even if they cut down, may experience withdrawal symptoms. They may start to perspire, their heart races, they can't sleep, they feel uncomfortable, they get very anxious, and what will most people do in that state is go back and drink more alcohol. So you end up in a vicious cycle that's very hard to break.
Are there any physical signs? People think about the red nose. Is there anything to that?
Oh, absolutely. I mean, not that if you have a red nose, you're an alcoholic. You may be Rudolph, okay? But there are physical changes that occur with people who've really been doing very heavy drinking. What I think is even more important, again, is sort of what Carol was talking about, was there may be cognitive changes and they may be subtle. One of the things we're beginning to understand is that as people age, for example, they tolerate alcohol less well. I mean, day to day, you may not see any changes, but there may actually be effects on brain functioning in terms of memory, in terms of working memory, in terms of being able to do tasks, being able to switch between tasks. And there may be a cumulative effect over time so that people actually, if they're drinking the same amount year in, year out over a long period of time, they may actually do less well in terms of their mental functioning. So I think that those are the kinds of signs that don't generally show up as often because they're more subtle, but may actually have more effects. Then there are obviously the other kinds of signs that you see that are sort of the classical ones in medicine. But when you see people with those kinds, with the big swollen belly that you get from a diseased liver, that's someone who's got a very severe case of the disease.
It's been going on a long time.
That's been going on a very long time. Yeah.
Carol Weiss, Rick Rosenthal, thank you very much for joining us.
Thank you.
Alcoholism is a very severe problem in this country. Diagnosis is the first and possibly the most important step, and we hope this webcast helped out. I'm Dr. David Marks. Thank you for joining us.